Hey guys, it's Ted Bogert. Welcome back to the Ted Show. This is actually a brand new series we are doing. Right now, we have a tentative name called Preventative Care, and we're going to dive into that. And I'm super excited to have my dear friend. He's so talented and gifted and generous and such a kind man. Dr. Saied is here with us. He is with apmuc.com, which is the website that I want you to go to and check out. But each week, we're going to talk about services that are provided at his office, the things that you can do to make your life better while you're living it, and the things that he offers, because there's always new technology coming out and new medical treatments and opportunities that are coming out. And so my dear friend is going to share that with us. Welcome. How are you?
Hi, how are you?
I'm doing great. It's so great to see you. It's exciting. Everybody loved the show or two that we did before. And now you have a lot of new things that you're offering.
Correct.
So let's give them the 411 on you. Let's give them a little bit of background on you.
Very good. Hi, everybody. My name is Saied Shemiranei, and I'm a medical doctor with background in trauma surgery and also emergency medicine and family medicine at this moment. Merging all these concepts together and caring about preventative care. And basically what I think generally people, they are looking at doctors' offices, naming the endocrine doctor, cardiology, GI practice, or oncology, infectology, and stuff like that. But have you ever thought why we don't have a word named preventive medicine?
I know.
Yeah, that's
right.
That's the message that I brought on board in my practice in the last 8 years in downtown Orlando.
Well,
and the preventative care is just the master of our practice. Although we are under a family medicine practice, but we put all these different alternatives in the medical practice to promote prevention and find out the root cause of the problem and go after the root cause rather than treat the disease.
It's interesting to me. I love that. And it's interesting to me because I feel like that's the opposite of what Western medicine does. We don't want to treat the root. We want to put a Band-Aid on it, medicate it, and try to figure out how to mitigate the symptoms instead of trying to get to the root of things and really figure out, okay, why is this happening to your body? Or what can I do to prevent this from happening to my body? And so I've always loved your approach because it's very, I don't know, in my experience, at least here in Orlando, it's very rare. I have MD friends, I have doctor friends, but they're very focused on a specific either endo or gastro or whatever it might be, cardio. And so they've already gotten to the point where there's a problem. And so they're trying to treat the issue. But nobody talks about how we can maybe avoid or mitigate the problem by preventative care. So kudos to you. Why did you take this approach? What was it? Was there a light bulb that went on and you said, I really want to focus on this. I feel like this is important.
Well, basically, to the fact that I have a very big passion in medicine, I was always thinking and learning about pathophysiology of any condition or any disease, and was thinking, wait a minute, if we have cardiovascular condition and if we have atherosclerosis, what are the cause of leading to a very advanced cardiovascular condition?
Yes.
And when you go back to the medical school, we were taught about all those causes. For example, a cardiovascular condition can be due to, of course, the biggest factor, unfortunately, genetics.
Yes.
In the first degree family. But there were other things involved, and they are very, very important. We are talking about the risk factors like smoking, hypertension, diabetes, high cholesterol, or inflammation in general in the level of endovascular. And the biggest thing these days, thinking about hormonal imbalance.
Yes.
That's why it led me to the fact that if I am dealing with a cardiovascular pathology, and if the patient comes and think that, oh, due to hypertension and cholesterol, maybe I get to a cardiovascular condition 2 decades from today.
Right.
Why don't we work on this and eliminate these root cause?
So that's when you say it, it sounds like it's an easy thing.
Yeah.
So, but most people wait. They don't want to hear that, or they think prevention is just telling them a whole bunch of things they shouldn't do. So talk a little bit about your mindset when you're talking about preventative care.
Correct. So every single patient that comes to my office, first of all, they are being encountered by me. Although I have nurse practitioners or medical assistants, staff helping me, but I do not like the fact that one big practice with so many assistants approach the patient, and when you go to that practice, every time you're being seen by another nurse practitioner.
Correct.
I never expanded my practice. This is another reason I don't have multiple offices, because I don't believe in this, and because I don't want to franchise myself and not to be able to attend the patient. If you look at our reviews online, they all said that we are seeing the doctor as a patient. We are seeing the doctor all the time. It's face-to-face, eye-to-eye contact. I do not like to have a computer, my desktop or laptop, and patient behind me just talking and I start typing. I want to have face-to-face contact, hear the patient very well, analyze the stuff that they say. Very important to hear the patient with detailed clinical history and go to the plan for their health guideline for the next 10 years and tell them, by this history, we have to care and we have to watch these things for the next 10 years and make a plan how we approach is through laboratories, very detailed labs that can help us how to manage the health plan for the next 10 years in a patient. Just in case, through a laboratory finding, if we find out that patient tend to have a prediabetes,
Right.
well, we work on that. How do we approach to this? Well, it's through nutritional consultation, and through lifestyle modification. And at some points, we seek help of medications. And I am very up to date. I kept myself all the time so far up to date with the best medication in the market, the state-of-art technologies, state-of-art treatment, go to the medical seminar all the time, approach to new research and medical journals, and keep myself very up to date with the treatment. So if we are talking about diabetes, people, they know Ozempic, they know semaglutide, right?
Right.
And now the time even passed, a lot of providers that they don't know how to work with Mounjaro or Wegovy.
Right.
And now I am putting all those things away and now dealing with Zepbound or tirzepatide. Why we use tirzepatide, for example? Because it's a newer version of medication
Right.
and work on 2 mechanisms rather than Ozempic that was only working as a GLP.
Right.
So Zepbound or tirzepatide is the product that we use now for weight loss and dealing with obesity. And that has to do with GLP and GIP, which is insulin resistance as well. And at the same time with GLP. So I always keep myself ahead of the game.
Yeah.
Now we are talking about inflammation. Let's just say a word or 2 statement about hormones. People, they come and we give them a checklist. The checklist is available on our website, apmuc.com. You go to the services, hormone replacement treatment. It says a scorecard. If you fill the scorecard on our website with questionnaires, it gives you the score about your health at the end and directly comes to me, not to anybody else in the
So
practice.
unique. It's so
And
unique.
then I personally call you and discuss the result. And if there is any need or any further action, I personally to notify you.
So rare.
So let's talk about that hormone things.
I do. I want to, really quick beforehand, I want to point out that obviously I've seen doctors my entire life. What has always been the challenge is I either get 2 seconds with a doctor who probably barely prepped before he walked in the door. No offense against all my MD friends. Or I'm seeing different NPs
Each time you go to the office.
or PAs every time I go to the office. And so there isn't for me, a continuity of care because I'm always having to re-explain myself and I've got to do it the next time with the next person. So kudos to you because that's such a beautiful, creative, and certainly a more impactful approach for the patient. So let's get back to hormones.
Correct. So about the hormones, I mean, hormone treatment, hormone replacement treatment, so-called HRTs, they're out there for decades, 60, 70 years. But the fact that everything evolves during the time, as you remember, we used to have cell phone that they look like a brick.
I remember.
And now,
look, we got this little old thing over here.
Almost disappearing, right? The size of the cell phones becoming smaller and lighter. So the same thing in medicine. In hormone replacement treatment, we had such an evolution in the last few decades. They used to have synthetic hormones, like progestin for female, and everybody for sure knows these medication, like this medication for sure, or these medications, they were synthetic and they were using 60 years ago, they were all carcinogen. So they were creating cancer. So this mentality is stuck with people and stay in their brain. As soon as you even say the word hormone, the very first question they said, oh, I don't want to get cancer. I would rather live with my symptoms.
Right.
But in the last 10 years or so, the evolution on hormone treatment, hormone replacement treatment, and the products and the medications, and the fact that the hormones that we use today is bioidentical.
Yes, what does that mean again?
Yeah, bioidenticals is just the hormone that is exactly like is your hormone that you had 30 years ago. So they're not synthetic in a sense.
I love that.
So the fact that bioidentical hormones, they are very, very effective and they're not dangerous anymore.
Right.
And the dose distribution in the body is based on the dose that we have in the body, as if you're secreting the same dose
That's
of
amazing.
hormone in the body. I'll give you an example. For example, testosterone level for, let's say, for a male, by laboratory guidance, it's between 250 and 1,000, for example. A lot of time, just because the doctors, they don't have enough, I would say, experience on this field. When they say, go to the lab, your annual, 80% still they don't check the testosterone.
No, they don't.
Well, if you're more than 35 years of age and above, one of the tests that should be requested on your annual checkup, it should be free testosterone and total testosterone. For example, a total testosterone of 250 to 1,000 is a range of laboratory, and when the result comes back in 350, if the doctor ordered this, it was smart enough to order a test like this, they look at the test result, they said, oh, by the way, we checked your hormone, testosterone is normal. Do you know 350, 400, 450, it's not a normal level of testosterone for a healthy male?
No, I only know that from you and from listening to you and hearing you. But if you come with a range, people are like, oh, it's in the it's in the test range, so I should be fine.
Exactly.
That's
But
not the case.
But we don't call normal anymore for the result of the test results. We call the optimal level. An optimal level for a male for testosterone, to total testosterone, should be around 1100. So the goal is to make the testosterone level up to that level. And for example, some symptoms that patients they're dealing with, and they go to their doctor even they check the testosterone and they said your testosterone normal, and then they said, why do I have all these symptoms? And the doctor said, I don't know, maybe you're tired, maybe you're work extra,
maybe you're old,
but that is not the case. Let me tell you something. Head to toe symptoms for low testosterone, I would say the testosterone number that is not optimal, if we want to call it head to toe symptoms, let's count it. Okay. Number one, brain fog. A lot of people, they're suffering from brain fog.
Yes.
They said, I take my key, I don't know where I put it. Then I have to go back inside the house and look for 20 minutes.
Right.
That is called brain fog.
Yes, it is.
Attention deficits.
Yes.
Stress, anxiety, insomnia. I said 5 symptoms already.
Right.
How many people, they don't have these symptoms?
Right.
Almost everybody has at least one.
That's true.
And then we are talking about inflammation. We are talking about muscle pain, joint pain, chronic fatigue, and generalized inflammation in the body, metabolic syndrome, sluggish metabolism, gaining weight, not to losing weight appropriately, and of course, sexual dysfunction,
right.
Lack of libido, lack of erections and stuff like that, right? So any of these symptoms can be due to a low testosterone level or not to be in an optimal level. That needs to be addressed. That needs to be addressed. Treated.
I guarantee you the guys out there listening are like, where do I sign up? Yeah, I feel like nobody talks about this, which is why this idea to have this show, I think, is just so important, because we are just all used to being treated, not necessarily an evaluation of what the root problem is and how we can address it, how we can minimize, and how we can feel better. We all want to feel better. I think most of us would, if you weren't on the show, most of us would say the reason we're feeling like this is because we're overworked and the whole world is just stressed out. And part of that may be true, but if you haven't had for men especially, had your testosterone checked, and you're just going based on the optimal levels that you're given in that range, then you're going along thinking, I just need better sleep. I need to stop stressing at night. I need to take XYZ pills in order to make me sleep at night. And so you're not getting at what's really going on with your body.
Correct. And also I want to say there are different treatment and there are different approach to raise the testosterone, for example, for a low testosterone level. A lot of people, they know there are patches available, there are gel, there are injectables. I'm sure you heard about this, everybody knows about this. Are there the optimal way to treat testosterone? The answer is a big fat no. So it's no. The optimal way to treat testosterone level and low testosterone at this moment is pellet insertion. And what pellet mean is these pellets, they're pharmaceuticals, they are bioidentical hormones. They look like a rice grain, beautiful white rice grain. And based on the calculation, 1, 2, 3, 4, whatever is needed, should be inserted under the skin with a very, very minimally procedure that is going to be done in our office within 5 minutes.
Wow.
And that's the state of art technology that we use these days to raise the testosterone.
This is the stuff just so you know, this is the stuff that you came to me with because what I love about you too is, obviously we're friends, so I can say that. What I love about you is that you are passionate about helping people. And so when an idea or when a new technology like this comes up and you've done your research and you know the benefits of it, you're excited for everybody to learn about it.
Yeah.
That's such a beautiful thing, because you don't, no offense again against my MD friends, but you don't get excited about a lot of things. So it's so wonderful to see you get excited about helping people feel better and have less of those things, the first 5 that you talked about.
The other thing is, a lot of my colleagues, they do not, that's the trick.
Yeah.
A lot of physicians, they do not want to go out of their comfort zone.
Yes, that's correct.
So if they know patches, gel, or injectables, why they have to go learn about something
new?
Yeah. And basically, this is a surgical procedure,
right?
So you have to have the talents and the hand of doing this procedure. A lot of people, they think, oh, if I want to put a trocar in somebody's body, oh, maybe there is a chance that I penetrates the abdomen and hit the liver.
Oh.
So you have to have enough experience.
I get it.
And with my surgical background, I feel extremely comfortable to do these procedures at minimal downtime, very, very easy. We have done it so many that it takes us a few minutes to perform and be comfortable to deliver the best method of treatment for something that can have amazing result.
Yeah.
If you come to our office, we show you patients' testimonial that they went through this procedure with minimal downtime and feeling great afterward. And I would say feeling better would be a scale of 4 weeks, and each week they feel 25% better.
Wow, that's
they
awesome.
all say in the first week, I felt 25% of my symptoms gone.
Wow.
Second week, 50%. Third week, 75%. In a month, we bring them back to the office. We draw blood, and we check the testosterone level. Every single patient, 100, 200, 250, 350, 400, the level goes to 1100 or 1200.
Wow.
And it stays there in a cruise control mode for the next few months. And that's amazing. They all feel great. They all feel energetic, and they send emails and call, and they say,
amazing.
Yeah, the difference.
So what we're gonna continue each week, talk a little bit about more about all of the things that Dr. Saied offers, and I want everyone to check out the website apmuc.com. The inventory, services are all listed there under hormones,
and it says a scorecard,
and that's it, the scorecard. That's the word.
And
then if you have questions, once you've gone to the site, if you have questions, reach out to me and we'll ask them each week. We'll see what, based on the services, and there's many that are offered at the office that you want to know more about, but we're going to take a deeper dive into the bioidentical newer pellet treatment. Is that what it's called?
Yes,
is it treatment, right?
Yes.
Each week, and we'll take a deeper dive. I know most people have the same fear of hormones that I have experienced because of the misinformation of the old synthetic, right?
Exactly.
So if you talk about bioidentical, we're going to take a deeper dive each week so you feel better about it. And if you're suffering, which everybody I talk to in my circle is suffering from at least one of those things you mentioned, you want to pay attention to what's going on. Schedule a consult with my friend here. Go to apmuc.com and then check in with us each week, because we're going to update you and give you more information and more insights. And if there's something very specific you want to ask, well, we've got the doctor in the house, so we're going to answer that. You're a joy to have on. Thank you for all you do. And I love, even off camera, when we have our personal conversations, he just talks passionately and compassionately about really helping and changing the way people live and their quality of life based on the different technologies that come into play. So we'll be back each week, and I'm super excited. Thank you so much for being back on the show. We'll be back, and you guys don't hesitate. If you want to talk to him sooner than later, reach out to the office. Go to apmuc.com, and we'll see you guys soon.